Hi, my name is Dr. Abhishek Parmar. I'm a surgeon and specialist in complex hernia here at UAB. Today I'd like to talk to y'all about hernias. So hernias to me represent a pretty interesting disease because while they're very common, there's a lot of misinformation out there about hernia. So I want to kind of set the record straight. So a hernia is just a hole. Hernias can form anywhere from your chest down to your groins. You can get a hernia by your belly button, or in your groin, or even in your upper part of your stomach, or even the sides of your stomachs. If you look at the side of your abdominal wall in this picture here, what's happening is, and what can happen with the hernia in this hole, is that your intestines can kind of poke through. Now thankfully, this is a pretty rare problem to happen. But if it does happen, you would need an emergency surgery to fix the hernia. So hernia is just a hole. So when we have to fix a hernia, the first thing we have to do is, of course, sew the hole closed. Now, many times, sewing the hole closed is just not enough. Our sutures are just not strong enough. So in those cases, we have to use the help of a piece of mesh. Now, mesh is something that comes up a lot in my discussions with my patients. And it can be a pretty scary thing to put a foreign body into your body. But thankfully, we know that mesh complications are actually quite rare. Unfortunately, with complex hernias, mesh is a very important element of our repair. And it's important to talk to your surgeon about mesh options or non-mesh options when you're considering your hernia repair. The other thing to think about when we do hernia repairs is the approach. What I mean by that is it through big incisions or small incisions? And what we do a lot of at UAB is fixing hernias through very small incisions. And that has the advantage of speeding up your recovery, minimizing your pain, and really helping your overall recovery.